Thank you. And last, we will now have Sandy Chen Stokes, founder of the Chinese American Coalition for Compassionate Care.
Hi, everybody. Getting a little bit hungry? Or tired? Yeah. Okay. Hi, everybody. Okay, this has always been my challenge. Okay. The first 5 years I worked with CACCC, I'm suffering because people don't know, easy to get me on the stage, very hard to get me off the stage. So 15 minutes. I haven't started warm up yet, but anyway, I can do it after 14 years. I can do it. Okay, so how I control this the slide? This one? That's easy. Okay, so everything about CACCC, please go to the second to the last page of your catalog. Okay, it's there. So I'm not going to say much. Yeah. So I just want to give you some brief information because we're going to talk about organization, how CACCC start. Why CACCC? I think the bottom line is we want to provide end-of-life service to the Chinese American, right? Very simple, not easy. Okay, first one, why we need it? Because we are a little bit different in some way, the culture, the language, right? Belief system. So this is the photo I took from Wuhan, China. I went to training program. That's in their hotel, fancy hotel. What happened? Why I show you this? Missing 4, number 4. Why? Huh? Oh, we have a Chinese here. Okay, so people say, Sandy, you are really not really open to everybody. You are Chinese. You should have a coalition for Asian, right? Because you're the same, right? Vietnamese, Korean, Japanese, Chinese. Why you only serve Chinese? This is one of the reasons, okay? Because Japanese don't say number 4 as a death, right? That's one reason. If you go to Taiwan, big IBM high-rise building, no number 4, okay? So please don't get upset if the family member or even patient refuse to get into the 4th floor or the room 4. That's a good reason because they are dying. They don't want to die in your room 4 bed, right? Okay, so know a little bit about the culture can be helpful. So what the Chinese American community needs, boy, we need a lot, okay? So I cannot have a list of everything, but I have a few points here I want to share with everybody. It's my experience. Number 1, we do need a language and cultural appropriate either services or education material, right? So we can communicate. Number 2, it will be the trust, okay? Without trust, I don't care how much I can provide for my Chinese patient. They won't take it, right? Yeah. When the visiting nurse or hospice nurse went into the Chinese house, knocked the door, they open. And the hospice nurse, non-Chinese, say, do you want me to take off my shoes? Totally. It's melt, okay? Please come in. They will serve you as a family member, a guest, right? So we know a little bit those culture, I think, can make a big difference because then we start build that trust there. You're not up here, I'm not down here. We can talk, okay? Chinese family and Chinese community love Sandy because I have a strong Chinese accent. I'm one of them, right? I'm not different from them. So we speak the same languages. And then another thing is we have end-of-life conversation. We never have been able to start it. Nobody want to talk about death. That's the reason at the beginning when I started this coalition, probably 100% of the 100%, my dear friends and family and everything, they say, don't do it. Not going to make it. You're going to close down in 2 months, right? Because we don't want to talk about. But that's a way to do it. So let me share with everybody. Number one, we use the coalition model. I have to thank CCCC. That's another coalition in California. And CEO right now is Judy Thomas. She's wonderful. We use the coalition model. Why? Because I'm by myself, right? I'm a nurse. And then that's all I know. But I can use the coalition model. We share the resources. We have our translate materials. Somebody going to use it, even we think we did a wonderful job, right? So we need our partners. So we have many partners, including like today we have Daphne Quad by AARP. She's our AAPI vice president, okay? Because of her, she will be able to help us to share the materials, the concept, and everything to the Chinese community, okay? And so on and so forth. So we train the bilingual volunteers. I came from California. How many languages we speak in California? We have people from UCSF. How many? 300 languages? Yeah. You cannot expect any medical center to have all kind of interpreters there ready for you or for call even. It's impossible. So we say, how about Chinese community? We can do something. We form a community volunteer base. We train them so they're good enough, our partner willing to open arm to welcome us, go to their facility to support their end-of-life patient, holding hand, just be there for them, right? Bring a Chinese newspaper, right? And also, we educate health professionals, yeah? We have so many doctors here. I feel very honored to be here, right? And I love American because we play as a team. When I first started as a nurse back in Taiwan, I have to serve tea to our doctor. Yeah, with great honor, right? But here it's different because we do care and doctor do treatment, right? We're a good team. The only problem is, I think Kimberly was mentioning that we have African American only like a 5% in the medical field as a doctor or professional. Chinese have another problem. We have like 90% of Chinese in medical field, all doctors. That's not the problem. The problem is, where are our Chinese nurses? Worse, where's our Chinese social worker? Our tiger mom, tiger dad, now they are aging. They're in the hospital bed, says, anybody can send a Chinese-speaking social worker. No, because you have your designated daughters and son all become a doctor. So now we get a problem here. Do you mind a Chinese speaking volunteers? Yes, I mean anybody, right? Speak Chinese. So we talk about balance. Okay, this is the balance we try to do, right? Okay, this is our first 30 hours. How to go back? I don't know why. Sorry. Oh, okay. Where's our, back in 2011, we have our first 30 hours end-of-life volunteer, Chinese-speaking volunteers, graduate from that class. And we're so happy. It's in Northern California. And thank you for California Healthcare Foundation give that grant. By the way, we only have 3 very part-time staff, paid staff. The rest is 100% almost all volunteer-based. Yeah. So they are starting there. Then we went to City of Hope. Then we went to everywhere. Now we're going to have our 6 Chinese volunteer training in New York. So we're very excited. So what CACCC did to meet community needs? Number one, I mentioned that we have to communicate with Chinese community. So Chinese material become very important. We made all those translation, first class, I think, because very accurate. Right? And then we have all kind of goodies. You can go to our website, you can see that. And I think here we called most form, right? Or post in Washington, D.C. Huh? Most Okay. In California, we call post. So we translate that every 2 years to revise, make it update. That's Dr. Rebecca Sador from UCSF. I think they have a prepare for. I'm so excited. Hopefully, it will be nationwide. Yeah. And then we also have 4 different decision ed series. So this one is the newest from the Conversation Project, which is partner with them. We just still in printing right now, haven't come out yet. We do DVD and other materials. This is the important part, reaching to the community. That's what we do, okay? And what we do is we use website, media, and then community outreach program. At the beginning, nobody want to talk to Sandy. They hang up on me because there's a crazy lady speak about that again, hang up. So we use the media because we don't have money, but we have media. As long as we convince them, this is the important thing. Do you remember people might have a heart disease, they might have a cancer, but not everybody has but everybody going to die. It's 100%. So if you can talk the way that people want to read it, want to be listened, if your senses increase, I bet your boss will let you do more. So in San Francisco, they only let me did one TV series and got a ding by her supervisor. But next year, she win the big award of the Generation Award, something. Then we start open up. So this is what we do, okay? We use the newspaper, TV, and we go to senior center. They have 4 of them in that group. It's a Catholic group. They are age 100. So people start open up. But in East Coast, we haven't started yet. So we are very happy to be here to introduce by New York yesterday and the day before. So our community service is many. It's all in that book there. But I want to mention something since we have 3 minutes here. Hospital Chinese Volunteer Ambassador Program. I don't know if anybody knows of a hospital in Mountain View, California. Yeah, called El Camino Hospital. They started brave enough to let CACCC to train a group of ambassadors, Chinese-speaking ambassadors, just go in to visit everybody, all Chinese. They got a list from the lobby, and then they went to visit them. Eventually, the reputation came out. Their Chinese census increased. And people's return, come back. They really think the service is so good, particularly Chinese. Because towards the end, where they need the most, the communication is at the end. At ICU, CCU, ER, when we have a Chinese volunteer there, receive 30-hour training. They know what to say and when not to talk, right? So that really helped our staff in the hospital. So I think that will be a good one. So we are very happy. That started 2014. And by early this year, we saw one in Southern California, Alhambra Hospital. They start their ambassador program as well. So I hope we'll be able to connect everybody together. And as a CACCC, we look ourselves as a bridge. We bridge a health provider with the Chinese community. We come a bridge between our family member and our patient. There's a lot of issues that come up to the surface when we facing end of life, right? So how to face the taboo? We find out this is the most exciting part, save for the last, we developed this car called Heart to Heart Car. And its idea came from a CODA Alliance Go Wish car. Anybody heard of Go Wish car? Yeah, right? Okay, we are a little bit different because we are talking about Chinese, right? We serve Chinese. Number one, bilingual. So anybody can use this and everybody play with. But the important part is just a secret of Chinese. We love gamble. You give a deck of a card to our senior. I don't care how sick we are, okay? We will pick it up, okay? So we have a different color with one box, same content. Inside the content, and we have all kind of end-of-life topic there, contents there. On the right-hand side, Anybody can answer to me? Oh, I have a 30 seconds. Okay. What that means, why after I die, don't touch my body for certain hours? The Chinese culture, religion's culture. We put all there. So Chinese people, when they pick this card, they say, they think about us. Okay, they really care for us. They just not the cookie cutter, right? So they will buy in there and we start conversation. Each deck have a 4 suits, like any poker. Each one have their meaning. It's very fun. Okay, we just done one at AARP office yesterday. Probably only 2 or 3 were Chinese, right? All non-Chinese. They love it. Okay, so I would like to see what we have. I'm minus now, sorry. Okay, this is what we like to do. The goal is we like to replicate. Whatever we did for the past 15 years, we like other minority group can work with us together. I like to have a coalition for Vietnamese, one coalition for Russian, okay? Don't reinvent the wheel and go through what we went through. That's what we want to do. We want to expand our services, not just serve the Chinese American in California, all over the country and internationally, right? You can see last few photos. This is in New York with Reimagine. We trained the volunteers. We went to Boston. And this one we went to Wuhan through the Project Hope. It's an American nonprofit organization. Then they start the palliative care there because they need so badly. So I would love to recruit a lot of the doctor there. Hopefully can teach and we learn all together. Okay. And this is our research. We need research because we don't have people help us to do the research and no funding either. But we did that. That's a Heart to Heart Cafe research. And I have more story to share. Hopefully we can work together. So thank you.